You may have noticed by now, today we are going red, all wearing red for women. It's National Wear Red Day as well as the American Heart Month. Here at CBS8, we are proud to partner with the Go Red Month. The American Heart Association says heart disease, believe it or not, is still the leading cause of death for women in the United States. Joining us now to talk more about the warning signs is Dr. Farah Dawood. She's a cardiologist at Sharp Healthcare and an American Heart Association volunteer. Dr. Dawood, thank you so much for coming in. We appreciate your time. Let's just jump right into that. I mentioned that cardiology problems, heart attacks, stroke are the leading cause of death for women in the United States. Does that mean more than cancer and some of these other things that we frequently hear more about?
Correct. Cardiovascular disease is the leading cause of death in women, exceeding cancer. My own mother had a heart attack right before I started medical school. Women need to be aware of their symptoms. They're very atypical and very different compared to men. For example, my mom showed up with atypical signs. She passed out and felt palpitations and rapid heart rate. Some women may feel fatigued, shortness of breath. So not everybody shows up with chest pain and jaw pain that we talk about.
You mentioned women feeling fatigued and shortness of breath and sometimes that tightening stress feeling.
Right.
I can tell you right now, almost every mother feels that way from time to time. When do you know it's a difference between just a rough day and it's time to call the doctor or rush straight to the hospital?
Right. I mean, anything more than your baseline, right? We all have, some of us have kids, stressful jobs, like you said, but anything more than your own baseline. You're feeling more fatigued than usual. You're a little more short of breath when you do your typical activities. Then it doesn't hurt to call a doctor and ask questions. Why am I feeling this way? Is my blood pressure high? Is my cholesterol high? And things like that. Be your own advocate.
One of the things that the American Heart Association really stresses is knowing your numbers.
Right.
When you go to the doctor and you get that annual physical, no matter how you're feeling or what age you're at, what should you be asking for? What specific tests should be run, just so you have that baseline?
In cardiovascular disease, the most important thing is primary prevention. So ask, what is my blood pressure? What's a normal blood pressure? What's my cholesterol? Is it high? Is it normal? What do I do to make it lower? And the steps I take to basically optimize my health.
Yeah, those are really important points, and I'm glad that you made that. One of the things that we're also focusing on this year is hands-only CPR.
Right.
And I think that you have a vision in your mind about what CPR looks like, especially if a stranger should collapse in front of you. Am I really going to put my mouth on top of theirs? We don't have to do that anymore. What should people know?
So CPR is very important. When people have a cardiac arrest, women unfortunately are less likely to receive CPR because of these barriers. You don't have to do mouth-to-mouth anymore. All you need to do is basically do chest compressions. Do chest compressions and have someone call paramedics to come and help you with it and help the patient. So just chest compressions.
Okay, so you're doing the chest compressions, you scream for somebody else to make that 911 call, and as long as you continue the chest compressions.
Continuously, don't stop. And if you get tired, you get a friend to help you.
Okay, good to know. Yeah. Really important, vital information, and could certainly save a life when we hear that this continues to take more lives, more women's lives specifically, than almost anything else. It's really hard to sort of wrap your mind around that.
Right.
All right, do it for your heart. All right, Dr. Dawood, thank you so much for your time. We do appreciate it. Don't forget about the American Heart Association's Go Red for Women Luncheon. It's coming up Friday, February 24th. I am honored to once again be the MC. If you'd like more information on that, go to heart.com/San Diego. Carlo.